Okay. Dr. Bakare Olumide is a medical doctor and a medical service manager with a core focus on healthcare protection operations, provider network development and cost control with HMO systems. Sorry, just a minute. Is it better now? Okay. Integrate clinical experts with structured and data-driven decision-making to oversee tariff designs, providers onboarding, and service optimization across healthcare networks. It plays an active role in building scalable system and expanding access through strategic provider placement, improving utilization patterns, and strengthening governance through SLAs, claims, oversight, and fraud control mechanisms. His work is defined by consistency and strict alignment with established benchmarks, practice in tariffs negotiation and network performance management. With a method of first principle approach, Dr. Bakare emphasizes clarity, structure, and long-term system efficiency, bridging frontline clinical reasons with high-level operational strategy to drive sustainable healthcare delivery. Please welcome Dr. Olumide Bakare. Thank you. Over to you, Dr. Olumide.
Good afternoon, everyone. Thank you very much, Oyin, for that introduction. I'm sure we've all had all the things our speakers have said, and we've talked about the mental, we've talked about the emotional, we've talked about the financial. So I would quickly want us to look at how all of these things tie together to affect our health, and also how we can manage our productivity as well. So just give me a moment. I would share my screen. Okay, so please let me know if we can see my screen so I can get right to it. Okay, so what we want to look at quickly, we want to look at how we can practice preventive healthcare as a boost for our productivity and control costs. Some of our speakers have talked about emergency cares and how some of these conditions can have an impact on our finances. So we want to see how we can practice preventive healthcare to boost productivity and also help with cost control. We'll also be looking at a few high impact conditions, particularly since we are talking about we're celebrating International Women's Day month. So we want to highlight a few high impact conditions that would can affect some of these things: breast cancer, cervical cancer, and a few chronic diseases. We also look at detection, how we can detect some of these things, and how we can practice routine screening and then workups in order to mitigate some of this risk. So why should we have this conversation? Why is it important, particularly for women? You know, in this part of the world, we unfortunately we don't really prioritize preventive health care. But even when these conversations are being had, it's not really discussed as an economic or productive issue. We look at it in the from more of the lens of a public health issue. And we need to have these conversations because women sit at the center of the workforce. They sit at the center of our family structure. They are primarily our caregivers in many settings. DFF talked about the care multiplier effect. So they are like the backbone of a lot of families, and also help in, they play a huge role in community health dynamics. So when a woman falls ill, you can be sure that a household is affected. You can be sure that there's some effect on place of employment, and then you can also be sure that if we don't have buffers, as DFF has rightly said, we can have escalation of some of these healthcare costs. So the burden of some of these conditions, I would want to focus on breast cancer, cervical cancer, and then we'll talk briefly on common chronic conditions that we see in this part of the world. Breast cancer, most commonly, is the most common cancer in women globally. Unfortunately, in this part of the world, because of a lack of some of these mechanisms we are going to talk about, most people that present with these conditions present very late. So it's usually at the point where we have some form of metastasis, and the options are really limited. And more often than not, you can't really do much. The only thing you can really do is palliative care, right? And so, breast late presentation, aggressive. Late presentation basically means aggressive treatment and then a reduced or poor survival rate. We also have cervical cancer. It is very common and usually caused by or associated with a virus known as human papilloma virus. It's a very common virus, and it's the peculiar thing about cervical cancer is it's something that can be easily screened for. The screening test is not something that I mean, most hospitals are able to do it, but because of the lack of awareness of preventive health systems, this we still have a very high number of some of these cases, and again because of this low screening uptake. We'll also be looking at chronic conditions like hypertension, diabetes, dyslipidemia, anemia, and how routine workups can also help identify these conditions early and then manage them appropriately. Hypertension, once again, is very common. Diabetes, very, very common. Dyslipidemia, too, very common. These conditions are usually asymptomatic early. They don't. They are silent killers, and because present. Um, they don't present very early. You would just wake up one morning and then someone you discover that um, someone you hear that someone collapsed at work and he was rushed to the hospital. He had a stroke. He could have been hypertensive for a while, but because of the fact that there was no screening, probably was not on medications, and so it was not properly managed and probably got to the tail end before it was identified. Right. So we've looked at some of these conditions. How does it tie into productivity? Um, Dr. Adetutu spoke about absenteeism in one of our slides. What it means is that you take time off for illness because you are not able to work. You visiting the hospital all the time. You multiple treatment cycles. Of course, when you are in that state of mind, you are not able to give your optimum performance. You're not able to give your best at work and even at other areas of life that your full attention might be required. There's also something called presenteeism, which, in my opinion, is much more worse than absenteeism because you're actually present at work, right? But you are ill. You're not able to do the job. So you are in the office. You're at your desk, but you are basically you're not working. You're not doing anything, right? And it is more insidious because people can have this presenteeism. They're at work and it just drags on, and over time you just see that there is a drop in productivity. There's a drop in output. Things are not moving the way they should. Again, another effect of health on productivity is workforce exit. So people with disabilities, people that unfortunately pass on prematurely or early retirement because of health conditions can take away some of the required experience that key members of your staff may have, which can adversely affect your organization. And then we have spillover effects. So because women are the ones carrying some of these responsibilities, we've talked about how they play a central role in our homes, in our offices. When we have quote unquote this downtime, some of that responsibility shifts to other people, and then there's also a reduction in household income and an increased dependency on or other people for support, increased dependency on loans and things like that, that can also exacerbate some of these things that we're talking about. Right. So the first thing I would want to talk about is breast cancer screening. Now, I'm sure almost everybody here would know what breast cancer is. So the thing is, it can actually be picked up very early if we have the proper preventive strategies in place. So the first one that we advise most women to do is breast self-examination. So you examine yourself. There's a technique that can be taught if you talk to your healthcare provider, right? And it helps you to pay attention to your body. You are self-aware, so any minor change would be quickly detected, and then you can easily manage it. And then we also have clinical breast examinations performed by your healthcare provider in a professional setting, and also used to quickly evaluate and see if there's anything to be worried about, and if there is the next steps that need to be taken so that it does not become a problem. And then we also have a mammogram or a mammography. This is basically a scan. So what happens here is we take an X-ray of the two breasts, and then we are trying to see if there are any lumps, if there are any changes that can signify that hey, something is going on here. So that again, the core idea here is doing these things will help us identify if there's a problem on time and quickly address this issue. We'll also talk about cervical cancer. Like I mentioned, it's unfortunately very common because we don't have screening practices in place. We don't have a lot of screening practices in place here. So what can we do? Well, we have what we call a pap smear, can be also done in the hospital setting. We have DNA testing, also done at your healthcare provider, and then something we call a VIA, visual inspection with acetic acid. Very low cost, very practical in resource limited settings like ours, right? So again, apart from breast cancer and cervical cancer, which we emphasize because we are trying to um, target women. We also have unfortunately, we have an epidemic of some of these conditions on this list. We have people that undiagnosed hypertensives, people that don't know what their blood sugar looks like. They don't know what their lipid profile is. They don't know what their BMI is. They don't know if they are anemic. And all these conditions have simple screening tests that you can do to track and identify if there's any problem at all. So for hypertension, you want to check your blood pressure. For diabetes, you want to check your blood sugar. For your lipid profile, that checks the amount of fats and oils basically, and that also helps to profile your cardiovascular risk. You also have your BMI, your full blood count. This also helps to identify obesity and anemia. And why are these things important? Why are we having this conversation? Because hypertension can lead to stroke. It can lead to high heart failure. And it's again like the example I mentioned. You have someone that goes to work. Unfortunately, you just hear that he's slumped, and they rush him to the hospital. Most of the time, this is usually the situation. Diabetes, chronic, it causes fatigue, it causes chronic infections and long-term organ damage. And then anemia, common in women because some women have conditions like fibroids. They have issues with their menstrual flow, and so they shed a lot of blood, can cause them to be anemic, and then reduces their energy and affects their output at work and in their personal lives. So putting everything together, we have the conditions listed here: breast cancer. We have the early stage impact, the late stage impact, and then how it affects our productivity. So for breast cancer, of course, it doesn't present on time, right? And then when you don't, it's not, you don't identify it on time, it's really not a problem. And then By the time it progresses to the late stage, the therapy becomes more intensive. There's a long recovery time, and this affects you you and the organization in the sense that you are not able to walk, and then unfortunately sometimes there's a need to exit the workplace. Cervical cancer, pretty much the same thing. You have there's really no problem at the beginning or until it progresses, and then it becomes a problem that you have to deal with. Same thing with hypertension. Most times, very asymptomatic, and then long term, you have serious disability. Diabetes too, same thing. Anemia too, the same thing. Right. So what are the barriers to preventive care? At an individual level, most people are not simply aware that these things exist, right? A lot of people too are also afraid of the diagnosis. Once you get that hypertension, there's a lot of fear. You hear cancer, there's a lot of stigma, there's a lot of God forbid, right? And then at the system level, we don't have enough screening infrastructure. There are cost barriers, and we don't really have referral systems that can help us access some of these services. So how do you, as an employer, come into play? You because again, this call is we have mid-level to senior level managers on this call. We can implement workplace screening programs for our staff, right? So that we are able to identify some of these conditions early, and then we can take the appropriate steps to mitigate the damage to both the person as an individual and both the organization, right? Because of the absenteeism that we've talked about, because of the reduction in productivity that you would likely have, right? And then as an HMO, what we do is we try to expand coverage to prevent preventive services, and then use data to identify at-risk populations, and then incentivize early screening, right? So what are recommendations? We recommend for health systems, HMOs, of course, offer health screening packages, age-based protocols, and then tracking the screening uptake as a KPI. And then for employers, like we mentioned, we want to promote awareness of preventive health, because if you really think about it, it actually affects your bottom line as an employer, right? And then at a policy level, we want to have programs that maybe subsidize some of these screenings, making it more accessible, right? And then for conditions like cervical cancer, we actually have vaccines, right, that can prevent some of these conditions. And then also strengthen our primary health care systems, right? So, in conclusion, preventive health care is not optional, it is strategic, right? Breast cancer, cervical cancer are very detectable. They are very detectable at an early stage, and it's preventable in case of cervical cancer because of the vaccine we talked about. And then early detection helps us to improve our health, helps us to improve productivity, also helps economic stability. So I think the core takeaway from this talk is we should try as individuals and as an organization to implement preventive healthcare strategies, both personally by taking up screenings when we can, checking your blood pressure, checking your blood sugar when you can, and then as an organization, trying to push preventive healthcare as a policy so that you are able to reduce the risk that comes with the long-term or down the road effect of some of these conditions. And then also you have a healthier workforce, you have a more productive workforce, and you have happier and more productive individuals too. All right. So thank you very much. I think I would like to stop here. Um, I hope I've been able to pass few things across. Thank you very much.